Hello, everyone. Good evening. Welcome to Hands Up with Dr. Brown, a special series dedicated to all the mental health inspired students and leaders. I'm Dr. Dawn Brown, a double board certified child, adolescent, and adult psychiatrist specializing in ADHD and sports psychiatry. And I'm beyond excited to have you join us again today. Last week was amazing, and I know tonight would definitely be even amazing as well, because we have some experts that will definitely just are genuine, here for you to answer any questions, share their journey, so you can actually learn more about the field that we love. But before we dive in, I want to take a moment to highlight an urgent reality. We're facing a severe shortage of mental health professionals, particularly psychiatrists, psychologists, and therapists. And according to recent stats, by the year of 2030, the United States is projected to be short around 15,600 psychiatrists alone. And when we look at minority representation, the numbers become even more alarming. Only about 4% of psychiatrists and 5% of psychologists identified as Black or African American, despite the growing need for mental health services in our communities. So this is why tonight's discussion is crucial. We need to expand the pipeline of mental health professionals, particularly those from minority backgrounds. And it's critical that we work together to produce, mentor, and encourage more minority leaders in this mental health space. If we don't, the consequences could be devastating. Entire populations may go untreated, and communities that would benefit the most from culturally competent care might be left out. So tonight's conversation is about inspiring and expanding the mindset of how mental health care can be practiced. This is why I've invited some amazing colleagues, who I also call friends, who have in this essential space. Now, I often get calls, texts, and requests from a lot of people curious about the career of a psychiatrist. Now, I know my mentees are watching. Make sure, again, you take notes and ask questions. And to all those who are here with us live, now is the time to get those questions answered. And not just from me, but from this incredible panel of experts who represent a wide range of mental health specialties, including child and adolescent psychiatry, adult psychiatry, addiction psychiatry, psychosis and psychospirituality psychiatry, and sports psychiatry. Together, we represent a broad spectrum of mental health experts and subspecialties. It's my pleasure to introduce our distinguished guests for this evening, Dr. Centrell Crawford and Dr. Karen Howell. Each of them brings a wealth of knowledge and experience to the table. So my good friends, Dr. Howell and Dr. Crawford, thank you so much for being here. And I want to just preference, I know we're missing Dr. Napoleon Higgins, who actually is doing some psychiatric work tonight, right? Educating people on pharmaceutical products and things that can help with mental health care and diagnosis and treatment. So we're sorry he couldn't be here tonight, but we have some awesome people here. So thank you all, ladies, for being here. I appreciate it. We'll have a girls' night.
That's right. Thank you for having me.
Yes, most definitely. Listen, when I thought about who I would love to introduce, just kind of this crowd, it's community too, who have expertise and knowledge and insight, who keep it real, it was a no-brainer for me. And so I really do appreciate both of you. Yes. And I want to go ahead and just have you all introduce yourselves. And whatever you want to share, please share.
Well, my name is Dr. Howell, of course, and I am a child, adolescent, and adult psychiatrist. I've been in practice since about 2011, just after completing my child psych fellowship. I currently work in two different settings. The first is in the early psychosis intervention clinic at Johns Hopkins, and I'm the lead psychiatrist there in the RAISE clinic, which is recovery after initial schizophrenia episode. So I've kind of developed a specialty niche in the area of recent and early onset schizophrenia. And then I have private practice also in Ellicott City, Maryland, so Howard County, Maryland. And there I treat children and adults medication management as well as psychotherapy. And I love using different modalities of psychotherapy to help people tap into their own internal healing ability.
Wow, Dr. Howell, every time you just share what you do, your journey, I'm just in awe. Thank you again, seriously. And I can't wait to get into a little bit more of your journey and some insights from you. So thank you so much for being here again.
Thank
And
you.
Dr. Crawford, yeah.
Hi. Yes. Hi. So I'm Dr. Central Crawford, founder, medical director of Option Psychiatry, which is my primary focus right now. I offer medication management for adults and children, as well as I just purchased a TMS machine, so I'll be doing transmagnetic stimulation as well in my community. I don't even know how many jobs I have. I have several jobs. I think it's because I have various interests between adults, children, addiction, outpatient care, which is completely different than inpatient care. And I'm actually really acute care by heart, but there's so many different types of. There's such a need, pretty much.
Yeah.
Especially, I live in Pennsylvania. There's such a need, so I try to fill it as much as I can. Right now, besides option psychiatry with the medication management at TMS, I also primarily work at a crisis unit where I just get walk-ins, 302s, which is involuntary commitments, and people who just need care and to be inpatient. So I pretty much triage them. So I've been doing that for the last, Jesus, actually, I Googled myself and it's like, oh, 12 years. I was like, where do you go? 12 years? I was like, no way. First of all, I don't feel that old. Second, man, it just flies. I actually, after COVID, everything just seems to, it's just 1 year I'm celebrating Christmas and the next I'm celebrating Christmas again. Those are the different things I do. So I like that psychiatry gives you versatility.
Yes.
And that's what I love the most about it. And, I think, with the need, especially with African Americans, and, I actually love this saying, Jesus in therapy, and that's kind of why I went into psychiatry, because I realized people had so much needs with depression. And also, you have the cousin who sits there and talks to himself, and then everyone's like, oh, just leave him alone. Actually, we need to address those things, not just let them sit in the corner and just, oh, it's okay.
Yes.
That's right. Absolutely.
Yeah,
That's so true. And again, in awe, and congratulations on your practice. Congratulations on TMS as well.
Yeah.
Much needed treatment option for people to have just a different option, and it works very well. So yeah, congratulations to that.
Yeah, actually, this weekend I was in Arizona and I actually met the inventor of TMS, Anthony Baker. I actually have a picture. Wow. I don't know if you can see the picture because it's blurry.
Oh wow!
But yeah, I took a picture. I don't know. I can't.
That's so awesome.
Yeah.
That's dope.
Yeah, I was actually 2 when he invented it, so I'm actually really young.
That's one of the things about one of the oldest fields that we're in. But look at this. I mean, just brings so much opportunity.
Yes.
And I'm glad you all shared that, all the variations that you do and the multiple roles that you have and the different environments that you practice and teach and author and all these things. And it's just amazing. Speaking, it's just amazing, right? I think our field is one of the few where we can just have so many jobs, right, Tommy?
Yes. That's right.
Right.
And it'd be so varied too.
Yes, exactly. Varied. And as I was kind of introducing kind of your subspecialties, I mean, I got questions with that. Like, oh my God, psychospirituality, what? Addiction recovery with like what? Okay. And someone they didn't know about addiction psychiatry as a subspecialty.
Yes.
Which is interesting. So, I think that this is just so enlightening for people to understand that there's so many subspecialties too within our field. And it's a field that you can actually grow old with if you want. You know what I'm saying? I have still mentees who are like in their 90s. Ooh. And I'm like, you still want to talk about cases?
I'm actually looking forward to being a 80-year-old psychiatrist. Like, I've heard it all. And they're like, oh wait, I didn't hear that. Wait.
Mm.
I tell you the truth.
Right.
Okay.
Yeah, I wouldn't be afraid then.
Exactly. I may need help too then. We gotta take turns. So no, ladies, thanks for being here. And I just want to really quick just get a shout out to our audience. We appreciate you. Dr. Loretta, thank you so much. Please share this with everyone you know. I see some people in and out of the room. So I definitely want to make sure that the experts and panelists definitely have the focus on them. And so I try not to put a lot of verbiage at the bottom until, there's different parts of the segment. But I think this is such an important conversation that we should, just basically really focus in on and really just talk about kind of the genuinity of our journeys, if you will, if that makes sense.
Yes.
So I want to start with you all. And if you, both can just share. So let me just introduce myself because I forgot to do that. So just in case anyone has questions, I'm Dr. Dawn Brown. I'm double board certified child and adult and sports psychiatry, which is not a field, a subspecialty, but it's recognized if you have so much expertise and knowledge in the field, then yes, you can have this type of role. I actually own and operate two private practices, ADHD Wellness Center, where I'm an ADHD expert, and I provide an all-inclusive type of service for my patients, medication management, coaching, education, and testing. And then I also have a practice called Mental Athletics, where I serve and cater to elite athletes of sports organizations. I'm also like Dr. Carolyn and Dr. Central, Tamia, if you want to call us. So I serve a clinic in California. I average like 110 patients a week. And I'm saying this because I've never said it before. So people be calling me, they be like, where you at? Or why you canceled? I serve 110 patients a week on average. I figured that out last week.
Oh my gosh.
I serve a Houston clinic where it's underserved kids, and we identify them through our HSID, which is Houston School District. We identify them and their families that they need in mental health services. I also supervise 12 nurse practitioners right now, as well as work as a second MD, which is basically a second opinion service too. So, yeah. So I'm working on trying to trim back as well. But I love what I do. And as long as I can do it, I'm gonna do it. That's probably like 6 more months. But as long as we're here to do it, right? So I just want to make sure I introduce myself just in case you have questions. So I definitely don't want to leave those out. But I'm really interested in how you all chose your fields, or did your fields choose you? Your subspecialties.
I love that question. Oh my gosh.
Yeah.
I mean, I guess I'd venture to say it's both, but I think probably it chose me more than I chose it. I say that because I've always kind of had a sense that I wanted to practice psychiatry. My mom is a child clinical psychologist, so the influence has always been there in terms of just mental health. And so, I think, I toyed with other specialties. I thought general peds. I've always been drawn to work with children, but I think that there's ways in which I wasn't prepared for exactly how my practice would evolve that further illustrated how it chose me, and I didn't necessarily just choose it. So, for example, I knew I was drawn to severe mental illness, and so I thought, okay, well, maybe I'll do inpatient work. That wasn't sustainable. So then it was like, okay, I definitely love the illness of schizophrenia. But why? I thought, maybe it's because I like to see how they can, change in dramatic ways and, improve and heal. But then I started to learn that it's also because I can see the ability, much like your practice on, and seeing the ability in ADHD and seeing the ability in schizophrenia and severe mental illness. And that my eyes had to open to over time. And that was the part that made me feel like it chose me.
Yes, I love that. That's beautiful. I love that. That's good.
I think it chose me as well.
Mhm.
Yeah. So as far as actually just psychiatry in general, so I actually went to med school for surgery because I had to find motivation in something. Being from where I come from in New
Yeah.
Orleans, and no one in my family's doctors, no one went to college, anything like that. So I read a lot, and so I ran across Ben Carson's book, Gifted Hands.
Mm-hmm.
So then that was kind of like my go-to, like, oh, I'm going to be like this guy. I'll go to John Hopkins and cut brains and detach Siamese twins. But then I got to surgery, and I was like, oh, I can't do 120 hours, which I actually do 120 hours. But we won't talk about my work schedule. Like, I do about 90. But we won't talk about my work schedule. So, I actually cut back. It's praise God. 2 weeks of cutting back on it. It was been a year. And I was in this OR, and this guy, everyone was running around him. He was going to get a pneumonectomy. Everyone's running around him, and I'm like the only med student there. He tries to jump off the gurney and run out the OR suite. I like grabbed him and like, yo, where are you going? He's like, I don't want to be in here. And I'm like, oh, and then I'm just like trying to talk him. I was like, yo, look, your wife says she's gonna make you some red beans. You're gonna get fried chicken. We just got to get through this surgery. This don't go anywhere. It's gonna save your life, And
keep it real.
Yeah, I keep it real. Like, yo, you gotta get this surgery. And then, after that experience, after him completing the surgery, I actually rotated into psychiatry. I was afraid of psychiatry. Like, yo, I gotta keep my name tag, and they gave me these keys. I don't want to lose any of this and be locked in this thing with these people. Like, I don't want to be locked in here with them. Like, they talking to themselves. That dude, sounds good. And so I was like, but I love hearing people's stories. I love hearing people's journeys, and I love working it through with them so that they can get out, get from under whatever darkness or cloud that they're dealing with at the time. So then I went into, residency. Then I had addiction rotations, detox and rehabs and outpatient clinics. And I realized addiction touched everyone. When I was, I just assumed it was like, we talked about the crack epidemic. I'm an African American. I'm from New Orleans. That's what's the big thing, marijuana. But then I have these big time people telling me their resume and telling me what I'm going to do, and they going to get their Xanax, and I better give it to them, or they going to who I think I am. Like, I'm black. I'm like, oh, yo, you know who I am? I'm like, I don't know who you are, but tell me. And they were just as messed up as the people they talk about in the news, robbing and blah blah blah. So I was like, oh, so it touches all walks of life,
Yeah.
This man has a business, he has employees, he has a family, and he can't get rid of the oxy. He can't get rid of the Xanax because he can't cope with all those pressures in his life. So I did that for the beginning of my career, and it just kept evolving. In which, like I said, the shortage. I just kept adding jobs. I never got rid of children off my books. Jeez, I was like, I'm not trained in this. So I've never. Well, I'm trained. I have a little bit, but I'm not a child psychiatrist. I'm still getting child jobs. People still requesting that because it's on my resume that I have experience. So it just kept going, and now I'm just here. Very experienced. I feel like I could talk to anybody, and I actually enjoy that. And the things that people tell me, I'm like, I know all that.
And let me just preface this to everybody. We all understand it here, but we have to laugh in our field. Like, when we laugh, it's not projecting anyone, it's not making fun of anyone's experience. You have to find laughter in what you do, whatever that job is, and especially in our job, because people call us at night because we don't have to be in the office to do what we do. So we got to learn how to, set the boundaries, but also find time and balance to kind of just laugh about a case that we had the day. That's why I call it the case of the day. And I just think about it, I'm like, what the hell?
But and it's a skill set. I know people probably think, oh my God, that's horrible. You heard that, and you say you see 110 patients, like it's literally back to back to back. And it's like, I have to, I might hear about the depression, the suicidal teen, and then I hear about the lady who's getting married, and I have to switch modes. I can't just linger on the kid hurting herself and then go to the next session and be joyful with my patient who's finally getting married, and without like having some type of filter, I guess. I don't really know what it
Yeah.
is.
Yeah. You got to cleanse in between.
Yeah.
Yeah.
And when it's really difficult, I go hide in the bathroom and just reset.
Yeah.
You know?
Mhm.
And actually, comedy works. Comedy works. I love comedy. Actually, I love Eddie Murphy. I mean, that's like his stand up will get you right. You're like, did he say that? He's right.
And all he's doing is really talking about our community, our culture, how we grew up. And he just, you know what I'm saying? But it's like I think you said, Dr. C, like, you know, we have to talk about the uncle in the room, the locked room who talks to himself. Like we can't normalize that to where it's a part of our culture. Everyone may have an uncle that they know that maybe, you know, something that representative of that. Yet still he may be dealing with some real issues.
Right.
And you know, it's interesting you said that, Dr. C, kind of your journey, because I actually wanted to be a neurosurgeon. I actually love Dr. Carson. I met him twice. I met Dr. Alexis Kennedy, who's our sword. I also met
Michigan in the house.
Yeah, that's right. Xavier Dow. No, I was kidding. And HBCUs in the house. But you know, I didn't want that life either. Like 16, 18, 20 hours. What the hell? But just fascinated with the brain, right? Fascinated with the mind.
Yes.
I want to see people get better, like you said, Carolyn. Wanted the opportunity to be, the gratitude of. That's what's gratifying, is that we're in a field where people can get better and they can live fulfilling lives. And regardless of the stigma, the shame, the guilt, the doubt, all those things, I mean, we really see people get better. And I think that's why we all have our own individual practices, so we can continue to, you know, monitor that for individuals and their families. You know, I think my field chose me. And it's interesting because I had diagnosed ADHD, right? So everybody knows the story. And so I just wanted to learn as much as I could about this condition because I was concerned I would not be a good doctor. But that stigma, I was like, I'm gonna show up late. I'm not listening. You know, I'm gonna get in trouble for my late notes. You know, I mean, I was really afraid of that. And so I just wanted to learn as much as I could and end up just kind of being an expert in the field. And then along the way, just kind of met a few athletes and who wanted help and who were just trusting me into that. And that spread into something different. So, you know, I think it is an interesting question. And maybe maybe I chose it too because I love it. And I think that I always tell my mentees, if you're good at what you do and you enjoy it, it's still a job. I don't ever believe it. It don't feel like work. Yes, it's still work because, you know, helps maintain your balance, but you can do whatever you want to do within that field. Money will come.
It'll come.
Expertise will come. All of that will come.
That's right. That's right.
Yeah.
Totally right.
So, So do you all think it's important to have, like as we kind of, you know, joke and get, you know, kid around how we kind of, you know, take a breather from our days. Do you feel it's important to have our own therapist as a part of our role in what we do?
Heck yeah. I have a therapist. Yes, indeed. Oh.
I don't just have Jesus. No, I have
I got Jesus.
Let's talk about it. Come on.
Oh, yes. No, it's
Jesus created therapists for us, didn't he?
Yes, he did. No, I have both.
Yeah.
I have a therapist. I have psychiatrists, and actual mentors, mentees, and coaches. So I have all of that.
Yeah. Because you're you know, we wear so many hats, you know, we have to try to achieve the, you know, the balance of life as you were talking about. And so sometimes I need help with that. And, you know, I suffer with anxiety and I've all my life, and I didn't get help for it until I was an adult. And so, like, for me, I feel like, you know, that was a necessary part of my healing, was to have a therapist to help me with the anxiety and medicine. At one point, I was on medicine for like 5 years. And so, yes, I still see him, thankful for him.
No, that's right.
Yes, indeed.
Thank you, Jesus.
It's very important. Yeah, I couldn't do this work without having my own.
That's so true. That's so true. And do you believe that what we go through on a day-to-day, how would you say, how fulfilling is it for you all? I know the different roles and responsibilities, you know, and you can go in any areas financially. Do you feel that just kind of self-worth? Like, the fulfillment that you get out of what you do in our special, like, how would you describe that to our mentees here?
Well, oh, it's a lot. I remember, yeah, because I work all over Pennsylvania pretty much. And I was in this job, and I was in the hallway, and this guy's like, Dr. Crawford, oh, I did exactly what you said I should do. And I was like, who are you? I was like, whatever. I was like, he's like, you don't remember me? And then he told me where I was like, then he told me his story. I was like, oh yeah, I remember you. Actually, I remember the story. And he's like, I have a house. I got married. And I was like, that's awesome. He was, but I don't know why he was there. Maybe he just had another issue at the time. But it was actually, he lit up when he saw me. And I was like, I hadn't seen that guy in over maybe 2-3 years. I hadn't worked that knowledge people. I hadn't worked at that job in a while. You know, that was that was early pandemic. I was like, oh, and then we were in a completely different setting. I was like, wow, he remembered me. And then when he told, I'm not a good face and name person, but I remember stories. So when he told me all of that, I was like, oh yeah, I remember you, because I had him on the inpatient unit so long. You know, I remember every day talking to him and, you know, trying to dial back all the things that he was going through with his life. And I felt at that, I was like, yo, he took me out of my day, because it was actually what I was doing was a mission. So I had to get people in the beds. So I was like, oh, okay. I actually do help people. I don't just put people in beds and add meds and PRNs, you know?
Yeah.
So those type of interactions and those type of times in my life when I remember, or someone says you helped me, it makes me go to the next step, or go to do more, or have the extra job, or try to make sure that I'm good so that I can help my patients. You know, I have so.
That's beautiful.
True. Absolutely. Yeah, I live for I live for moments like that. I'm so glad you asked this question, because it helps. I constantly have to ask myself questions like that. And really get in touch with those moments when I feel most fulfilled, so I can kind of like continue to work to kind of like create the niche in that area, like, and allow me to have increase where my passions lie. But I got to get in touch with where my passion is. But yeah, I think the best compliment I ever received was, I treat a family where I treat multiple siblings, and one of them has a daughter, and she said that they were playing Dr. Howe, like with a toy, like they were playing like they were trading the baby toy. And that's like something they commonly do, is just play Dr. Howe. And I swear,
wow,
you know, that warmed my heart and touched my soul in a way that reminded me like why I do this, like, so that I'm inspirational enough to someone that your young age, she's probably 2, that's how you decide to play, knowing how important play is as a child psychiatrist.
Come on. I'm about to shed tears over here. I'm trying to,
because I'm sure we all played with that stethoscope as kids. So if we don't do that, you know, we all did it. So
we
all did it. That was the beginning.
We all did it.
That was the beginning. And we, you know, so that part, and knowing that the mom would say, like, you know, I don't know where we would be, you know, where our family would be without you. Those are the moments. Or just when you have been working so hard with someone in therapy about something, and then all of a sudden they get it, and you know what I mean? They embraced it, and it was like, oh yes, that's right.
Celebrate you.
Oh, that feeling, I think, is truly everything. So I mean, I think that those moments, sometimes you get weary because you realize that it may have been a while since you've had a moment like that, and you got to stay encouraged. But then you said from multiple perspectives. So financially, I feel fulfilled. I feel like, you know.
I think Dr. C.
Are they hiring over there?
I think that it has provided, you know, I work hard for the money, but I will say that I think it has provided a life where I can still have the balance that I need to have. And I'm still working on achieving that in the most precise way, but I do feel thankful that it can afford me that. Yeah, for sure.
Man.
Oh,
Amen.
I have fun with my time. Yeah, I work a lot, but I like to travel. Uh,
Yeah.
yeah, so um, I joined this travel group. Financially, I didn't know, I didn't know doctors made as much as we do. But it's
Mhm.
probably, and whatever. I mean, it's a big sacrifice. But I enjoy traveling and learning about different cultures. I think that's the biggest gift I have from medicine. Um,
Yes. Yes,
I guess
indeed.
it's still just
Me
learning people.
too.
Apparently, it's learning people and places and things.
Jeez.
Yeah,
I mean, that's my Dr. Carol is my twin. You are my soul sister,
that's right.
Dr. Central.
Yes,
Yes.
indeed. That's
Because
right.
me and Dr. Carolyn always have had similar journeys, similar paths. Mindset is similar. And now
Back.
I'm learning more about you right now, too, Dr. Central. Because, I love to travel and I love cultures and I love to understand just human connection
Yeah.
in different spaces. And that just, I mean, I can do that all day. If I could quit and do that, I would.
Yeah.
Outright all about that.
I actually
But
want to do that.
Mhm.
I know, right? Exactly. Can someone just pay me to do that?
Right.
But I wanna bust a myth, because if you look at the salaries and you see psychiatrists, where are we all?
At
Do you
the
see where we
bottom.
are?
Kind of in the bottom
Bottom.
third.
So let's bust. I'm gonna look in the camera right here. Let's bust
Okay.
this myth. Listen, y'all, we are not at the bottom.
We're not in
We
the
are
bottom
at the
third.
top.
At the top.
Yeah.
Ooh.
Well, not as
Give me
much as surgeon, but
okay, okay.
if you think about work-life balance, we're pretty up
Yes.
there.
So
Let's first consider salary. Are we
Okay.
really at the bottom?
No, we're not at the bottom.
No, we're not. Now, how would you compare our salaries with others? Like, can we make it portable? Not necessarily to give our own personal, but just to kind of make it portable for people. Because I think what is misunderstanding, especially the medical students and residents, is that this is what we learned coming to this field. And now I'm hearing board scores are go up for psychiatry more than dermatology now. People are understanding that we can do our work from home with telemedicine. People understand we can actually make our own like consulting, consultation practices and be here one day and they're the next. I mean, just the freedom to move
That's right.
around and practice medicine how we want is something inspiring, I would think, you know?
Absolutely. I mean, I guess we could go off of, I know that it's probably not on like we get offers for jobs, right? That come in the mail, and I'm always curious. And when I see the
They
figures,
call
I'm
me
like,
every day.
so many, it's such a need to the point where, I mean, I saw an offering and now it was rural, probably, very rural town, Midwest, maybe, but yeah, like, 400, 500,000. Like, I was like, whoa, I was really surprised.
Yeah.
Like even saying it right now, I was like I didn't say it with assurance. Like, did I really see that figure? But yeah, no. So that puts things into perspective about like what the potential is, And I'm not saying that's the average or the norm. That sounds like surgical specialty figures, right?
There you go.
Right.
That's exactly what I wanted to compare it to, because it is.
Yeah.
And we don't have to spend 16 hours in a room to get that.
Right. No, it's true.
Nothing against our surgeons. Nothing, because I want to be a surgeon. I think we have a connection with surgeons.
Yeah.
Even though so many opposites, but so many similarities. But
really?
I mean, I had even my residency program, I had 2 former surgeons in my residency program, adult training program. They were surgeons.
Really? I just know surgeons hated me on my surgery rotation. They were probably like, let's hurry up and get this girl to psychiatry something. Yeah. I had no sense of direction. They were like, help her. But I passed. I got through. Thank you,
girl. You're genius over there.
But
right?
see that psychiatry is getting more competitive. I think people are looking at the work-life balance a lot more than previous generations.
Yeah.
And also being able to have so much flexibility in what you can do. Like you can work from home, you can work in the hospital. And I was talking to some residents. I do have residents the other day, and they were talking about how many applications, because I guess their program is very open to open discussion, how many applicants they got for their program. And this other attending was like, yeah, I like it now. I like it when, they have to fight for us. Like, what's that around?
Wow.
Yeah.
I mean, things have changed.
Yeah, that's right.
Things have changed. And then let's go ahead and go a little bit deeper, being a minority in this field. I mean, I have people who look for me and they can have schizophrenia and they're still and want me to assist them. And I will.
Yeah.
I may not treat, but I will refer. You know what I'm saying?
Yeah.
I mean, because they're looking specifically for people that look like them. And so, I think that's another way of how we can help so many people within our own fields, because they trust the experience. They trust us. They trust the process. We look like us. We can talk to them, where they understand. They don't feel dismissed or mistreated. You know what I'm saying? Or misguided. Yeah.
So we know most of their little idioms.
Right. Okay.
Yeah. It matters. It really
matters.
It matters.
It does. It does.
Yeah.
It does. Yes. Yeah. Is there any other field that you would want to do if you had the opportunity? And I wouldn't say do it all over, because I don't think that's a fair question. I think if there's any field that you would like to explore, in whatever time of your life, what would that field be? I'm just curious.
Oh, anything, not even outside of medicine?
Yeah. Yeah, anything.
Oh, interior design, no question. Interior design, interior decorating. Woo! Yes, I would love to do that. I'd love to train and be on HGTV, like all the people I admire, like Windy City Rehab. I would want to do that.
Can I be a housewife without kids?
Yeah. You just try to get out of any of the type of responsibility that you currently have. Okay, and I get it.
That is funny.
I'm trying to tell you, there's a huge connection here. I actually wanted to do fashion design. Yes, but never really, it just wasn't a class at Xavier, wasn't, I mean, I always knew I wanted to be a doctor, but there was no model for me.
Right.
It wasn't a Ben Carson or Let's kind of day when I was little and had the stethoscope when my mom gave me when I was 6. I think our parents were pushed that on us a little bit, but thank God and I get it.
Yeah.
I actually would do film. I will do more films.
Oh,
yes. You're a producer, Dr. Crawford.
Yeah.
You got your own movie.
I do. I'm working on my second one. I need to do some editing. Yeah.
That's so cool.
So that's what I would do. I would try to focus more, get more training on that.
But
you got all that fashion stuff going on. Well, whatever that thing is around your neck.
Whatever this thing is. Statement pieces. I know.
Oh, that's statement pieces.
Statement pieces.
I like it.
Yeah. I think I would want it, not as a hobby, but as a career. And I think I would want to do that. And as we, because we talked about this before we started the segment, that our field is also one of the oldest fields where you can grow old with it, is how I describe it. So I have a mentor student that's 91 years old that I still communicate with back from my adult training. And of course he's retired, but every once in a while I just talk to him and he wants to talk about cases I've seen. And I think it's for him too, because he loved the field so much. I think he retired when he was 72 or something like that. So, you don't find too many surgeons. I mean, maybe you do, but I don't see them that are, that can actually do what we do, because this is our mouth, and our mouthpiece is our gift and our business. And so, and our intellect, right. And our ability to connect with others. And that's another question I have for you all next. But I think this is one of the oldest fields. So I also want to just kind of encourage people who are interested in mental health that this is not the only career that you have to do either, or be involved in, or think is limiting for you. I think when we think about careers, we think about our entire lives, because we minimize the ability to be able to do more. And I think this is one career where you can actually have the opportunity of doing a completely different thing, whether it's during retirement or while you're working as a consultant.
Mm-hmm.
Do you all agree with that?
I do. Absolutely.
Yeah.
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 Absolutely.
And don't allow being in school for 20 plus years. Don't allow that to minimize your gifts and talents of exploring other ways of trying to be committed to something that was, you had to work hard in for 20 plus years. You could still use similar knowledge and still create a lifestyle outside of medicine. And I just want to encourage, I talk to my residents about that all the time, because that was how it was presented to me as well. But I really found that on my own, is that I created my own path. Like I started doing virtual in 2016. You know what I'm saying? Like as a practice.
Yeah.
Yeah. And it was like no one, and I was like, man, I could do this like this. Okay. And still prescribe controlled substances.
That's right.
Okay.
Before the pandemic. That's right.
Yeah. And then was ready, because people came to me during the pandemic, like, how do you do this?
Right.
How did, and so that could have been a business, so I just want to encourage someone. But what are the qualities and characteristics do you believe that make a good psychiatrist? Like, because there are people out there that really want to do this. And I've actually had that question. Like, I don't think I have the patience to see this, like, borderline personality disorder. I've had that. And I'm like, we don't necessarily have to do that. But what are the qualities that you feel have allowed you to prosper in your subspecialties?
Ooh. Well, you definitely have to respect people. You have to have respect for people, and you have to also be able to listen very well, to be an empathic listener. That's very, very key. I mean, because I like this to see, what I'm doing is treating souls, and so helping people to understand their soul work. And so when people experience hardship, like in this, suffering from mental illness, that is a part of their soul's journey towards purpose. And so if you're not listening for kernels in terms of like what a person's purpose is, if you're not really listening, then you miss an opportunity. That's why that show Brilliant Minds.
Yes.
If y'all seen that,
I love it. I love it. I told my brother it's like the new house in a sense.
Yeah. He speaks to my heart. Now he goes,
Awesome.
I know that he goes way above and beyond. And so while you got to have boundaries, I get his heart. You know what I mean?
Yeah.
Like, you can tell that is the picture of someone who was born to do it and gets the art of it, as opposed to just the rote science of it. Right.
That's powerful.
Yeah. So that's, you got to have those two things, I would say, at least.
Yes.
Yeah, I'll just piggyback off that. A heart for people and good listening skills and curiosity, because, what are you not saying to me?
Yes.
People like to have this face, and he's like, and then if you could just like get the right question, then everything just falls and the gates open and you're like, oh, that's what you're trying to hide.
100%. Yes.
And once they finally open up and they're like, how do you feel about that?
Yeah. Piggybacking off of that too. Like, that's why I love, I stress the importance of intuition, because people have a facade. I remember one time sitting before a patient, I was literally like, for some reason, it felt like there was all of a sudden a screen that came down over like my eyes. And I knew in that minute, I was like, she's not being honest about her true feelings. And so I just spoke to that thing in the moment. I was like, I'm feeling like, you're saying, X, Y, and Z, but you really might feel like X, Y, and Z, A, B, and C. And she just wept. And so that's so true. It's like you're listening for it. And then also, man, activating that that mojo, that intuition mojo,
Mhm.
that never fails you too, because that's when you go off track. That's that Jan Levon Zant kind of,
Yeah.
Right.
you go off,
Come
not
on.
off track, off script, off script.
Script.
You know what I'm
Tell it
saying?
like it is. Yes.
Yeah.
Dr. Phil.
Yeah.
I'm sorry. But you know what you all really, I mean, how I interpret what you all are saying is that we have a true gift in this field, right? Because I call it energies. I can just feel people's energies.
Right.
And you described it the same way I would describe it. We just maybe call it a little different things. But I can tell when people are not necessarily being truthful.
Right.
And I don't, I mean, I have the gift of that. Now, this is not with everybody. I don't want people calling me and be like, can you tell if my husband, wife, or uncle, sister, brother being, no, that's not me. Okay? I'm just saying within my field,
Right.
within my questions, understanding their depression, their anxiety, their ADHD, I have an idea. So when a parent becomes, when I know she's frightened and she doesn't say it, and I say that, this is the diagnosis, and I would be concerned if you weren't, and this is how we can approach it.
Yes.
And are you having any reservations about this? Here's some, resources to read about. And I just say it because I already know she's feeling it. And
Yes.
so, I had a case like that yesterday, and she's like, Dr. Brown, thank you for that, because I just didn't know how to communicate that to you, because I care about my child, but I'm scared as a parent. And
Yes.
That's real. And I don't have to be a parent to understand that. I'm a human being to understand how real that is. When you love and care about someone and you really want to do well, but you have your own, concerns. And, and so I feel that, I do believe that in order to be a good mental health provider, it is important that you realize that there's a gift to this, because I do know some doctors that are really not doing well, and so I think it's a true gift. But I'm an empath, and it's a blessing and a curse.
Yes.
Right?
Yes. Me too, Dr. Dawn.
So
Yes.
learning how to say no, learning how to say wait.
I tell
learning how to
myself
say
all the
no.
time, no is a complete sentence. No is a complete
It is
sentence. Say no. Say no.
Yeah.
You know what I'm saying? Because we agree to 8,000 things, not realizing I'm fucking overwhelmed. Excuse my language. Overwhelmed. I'm sorry. I forgot where I was. I'm sorry, y'all. I'm gonna beat that
Unplug.
That's
keep
so
it real
funny.
tonight with y'all. Different personalities of our sides, because it's real. This is who we are.
Yeah.
And I'm glad we get to talk, even if it's not every day, touch in with each other, because I think that's also important. We know that mental health conditions, especially suicide, is actually higher than general population in doctors than is the general population. And I feel that us as doctors who serve others, who treat others, who are part of this healing process that God has, journeyed and destined for us, I feel that we just don't get to treat ourselves or heal ourselves either, or the time and the space for it, or communicate with each other like, oh girl, you experienced that too, and I thought it was just me, and we need to do more of that. But I think that's, I think these qualities are so important, when you hone down to understand, because I get that all the time. How do you know you're a real good psychiatrist? I'm like, that's a hard question. But then I start to think about it, so I'm like, it's really not a hard question. And we're not talking Bible, like you have to be empathetic, you have to be an energy filler, you have to have intuition. We think that they're great qualities who allowed us as psychiatrists to get far with our patients and to provide the right management that's been effective and beneficial. But I do believe that they're very important characteristics and traits to have.
Yeah.
And patience.
Yeah, and patience. Oh,
they like to dance on the patience.
Yes. Indeed. Yeah.
Okay.
Like I said, I go hide in the bathroom. I gotta come back. Give me a second.
Yes.
So, y'all,
Yeah.
I think another career with us is that we're comedic. We are not this weird career people. Like, I hear that a lot. We're going to bust that myth too. We're not weird. We're
Yes.
not eccentric. I mean, we're just
Maybe a little
lively
bit.
and we
Maybe
love to have
just,
fun. Okay, just a little different. But yeah, we like to have
But-
fun, you know?
yeah. Yeah.
Maybe
That's
every
true.
joke I tell is not funny, but it's funny to me. Hey, you know?
Right.
I
mean,
like my jokes.
yeah,
Yes,
people need to know that
exactly.
psychiatrists can be relatable, right? And
Yeah.
chill, right?
Yeah.
That's
Seriously.
it.
Yeah.
Especially when you're talking to someone that's so intimate and sometimes, you know, conflicting to. And that's
Yeah.
what I wanted to ask you. I know we're nearing our end because I don't want to take too much of time. I so much enjoyed this conversation.
Me too.
And I love
Great,
how it's so
actually.
different than last week's. You know, I think both weeks had their own strengths. And I really appreciate our conversation tonight. Just wanted to stop and tell y'all that. But psychospirituality. Carolyn?
Oh Lord.
Ooh. I love it. I mean, I love it as a Christian. I love it as a psychiatrist. I think they definitely enmesh. I think there's such things as spiritual illnesses that we can't treat with medicines, therapy, TMS, ECT, DBT, you know, all these, whatever. You know, I mean, why not? Why is that not a subspecialty?
Yeah, I definitely think that I would love at least for it to be incorporated more into training. Like I don't think in my training for adult or for child that the word intuition or even gut was used one time. Like, and so I think that, you know, we're kind of, as we've already talked about, like what makes someone a good psychiatrist, and we're saying, you know, intuition, you know, and being empathic, right? These are abilities. So, you know, the integration of spirituality into psychiatry it doesn't have to mean that we're all of a sudden like Christian counselors, you know, or this is not, doesn't have a religious, you know, inclination. It's more, I think, for me, what resonates is that it's the recognition that we all have our own intrinsic healing ability, and if that's the case, then I'm just a conduit to help you tap into that, so that you ain't got to sit on my couch for 60 years. You know what I'm saying? To get better,
Right.
but you continue to do that lifelong work because we're always healing, right? But
Yeah.
you know, if someone is inclined, you know, like because they're Christian and, you know, I'm Christian, you know, then we can have that dialogue in terms of how they feel like they want their faith to play a role in their healing. And so I do feel like we're doing that more in medicine, like, you know, we're acknowledging that part, but then it's kind of like, well, okay, but then now that we say, okay, she does, well, then what? That's the part that
Yes.
is the next step for that. But and sometimes it's like what you said, Dawn, is energy, like understanding energy. That can be a component of psychospiritual work, right? So like if you take
Yes.
someone out to, you know, to ground and, you know, as a mindfulness strategy, that's spirituality, right? Someone
Yes,
connecting with
it
nature.
is.
So like it doesn't have to be like, you know, religious or, you
And I'm
know.
so glad you brought that up. And thanks for correcting me
No,
because
I'm
I
not
think that is.
correcting.
Oh no 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 no! I want no. I no. Thanks for no because I
I was,
feel that when I first heard that,
yeah,
and we talked about this too. But I'm
yeah.
talking to the person who thinks it is. And when I
Ah,
first heard what you did before you explained
yeah,
it to me, I
yeah,
thought, you know, I didn't know, and
yeah.
but I knew spirituality was bigger than just religion. And
Right,
I
right.
love how I think initially you said, I treat the soul. I'm like, that's deep.
Yes, yes,
I
yes.
love that's your tagline. TM that. I treat the soul.
Look, Tia, go
Yeah.
call her trademark attorney.
We got a couple
Yes.
we know.
Yeah, no, for real.
That's deep.
Absolutely.
That's
Yeah,
deep. And
yeah,
I think that's what we're missing out on. That's why I need this as a subspecialty. We are missing the boat. Everything is
yeah.
not just straight this, that, and the other. I mean, these are deeper than this. You know what I'm
Yeah, and
saying? Than what
my
we're
patients,
acknowledging.
true. And I think my patients were coming to me with things that like I think were beyond my medical understanding. So I just had to, like you said, Dr. Central, like have a curiosity and just like a healthy openness around their experience. I mean, like even children that would just say, "Oh, you know, I see people who have passed on." You know what I mean? And so like and their mom didn't believe them. So then it's kind of like, okay, well, let's talk about it, right? Because, maybe they had no forum to be able to talk about seeing spirits, and I don't want to over medicalize that or pathologize that and be like, oh my God, let me rule out psychosis. Like, I got to stay erudite and appropriate about that. But at the same time, I could also just have a conversation about seeing spirits from a spiritual perspective, right? You know what I mean? So like,
I just watched Sixth Sense. That kind of put me in that vibe where the kid was experiencing the spirit, and it's just like, oh, you just but
yeah, exactly.
Yes.
I mean, some of the things are just really about just openness and understanding. So
I actually got dinged. I actually remember in residency when I was attending was like, oh, you're trying to use your gut. I was like, dude, I'm using the DSM is right next to me. It's right here. Like, it's sitting next to me. How am I just using my gut? Like, I'm opening the book and reading the diagnostic criteria. Like, and we set how we set in the table. It was right next to me all the time. So how was I just using my gut?
Like, but he was saying it as if to minimize it, like
minimize what I was saying. Yeah,
like you're just trying to fly by
right. Yeah, but
for multiple reasons. I don't like that one, he's dismissing your medical acumen.
Exactly.
Right.
And I also don't like that he's making it seem like not using your gut was some problem, because that actually
exactly.
Right. Oh my
exactly.
goodness.
Yeah. So. Exactly.
But I'm actually enjoying my own journey, like learning about people, learning about different religions, learning my travel. I am starting to do the grounding myself. I am starting to do the nature stuff. It's actually been very freeing for myself, and I think it's improving my practice. So
yes, it does.
I love that. I love that. And then, Dr. Central, I just wanted to ask you about TMS, because I had a question of what that is and what does that treat?
Okay, so TMS is transmagnetic stimulation. It's been around for several years. The first device was approved. I did this. I had a lecture recently, but I don't know. Anyway, it was created in 1985. The first device, the FDA approved it in like 2000 for treatment-resistant depression. And there's other indications. The FDA is allowing for OCD, depending on what coral they're using, smoking cessation, migraines. So it's a different way. I actually had some guy told me, he's like, as a psychiatrist, all we have was our Kleenex as a medical tools. So now we have, ECT, we have TMS, and trans vagal nerve stimulation, those type of things. It's just another modality to help patients get better.
Mm-hmm.
So.
And Dr. Citral, is it invasive? And can you how long does it take? I mean,
it's not invasive. Well, there's different protocols. Thank you. That's the word. Getting tired, losing my words. Protocols. It could be the 3 minutes to a 30-minute sessions. Depends on which protocol is decided upon. It's not invasive. There's no. It's an outpatient procedure. You can actually leave the clinic and go home. Versus, like ECT, you have to be under anesthesia. Actually, back in the day, ECT didn't even have an anesthesia. They just put a little thing in your mouth and shock your head with,
And Dr. Central, can I do this on my lunch break? It is an alternative to medication treatment.
No, you can. Well, yes, you could do it on your lunch break.
I want to make it affordable for people.
Yeah. Well, no, you come 30 minutes. You come in the morning. You come in lunch. 30-minute sessions. You actually can do it concurrently with your medication. You don't have to get off your meds to be on TMS. It's actually better to do it with.
Mm-hmm.
Thank you. Thank you so much. I had a couple of patients who actually just gave up on medication management, and they were like, what do I do? Right. And so we talked about TMS, and I know one has started. I don't know how they're doing, but I'm very familiar. I was going to actually get involved with TMS a couple of years ago, and it just wasn't in where God wanted me. But I think it's fabulous that you are doing this. I really do.
36 sessions over a month. Actually, Stanford came out with a protocol, which is interesting, where it's like 10 sections for 5 days, but that's specialized.
Wow. Oh wow.
but they released that protocol a couple years ago, and it's got approved by the FDA. Um,
That's
but no,
awesome.
but it's supposed to be quick and easy. You come in, 20 minutes, then you go home or go to work.
That's great.
One
And
of the
insurance
common
coverage
side effects,
too.
insurance
Sorry.
coverage. Yeah, one of the side effects is maybe a little headache, but other than that,
Mhm.
discomfort in your scalp. Insurance coverage, or you can pay cash. I like cash, but
I know that's right. I do too. That's right.
no kidding.
Ladies, thank you.
Insurance. I take insurance.
Mhm.
I'll go fight your insurance for you. Don't have to worry about that.
I know that's right. Is there anything else you would like to leave our audience with? Anything that comes out the dome? Anything. This has been I just don't want to stop, but this has been fabulous. I really enjoyed our conversation this evening.
Mm. Let's see. Well, I would say that if you're thinking about psychiatry, please explore it. Like it's an awesome field. I love what I do. I wouldn't replace it. And it's rewarding for a lot of reasons. And we've listed a lot of the reasons, why it is in terms of, how we feel fulfilled personally and how varied it is as a specialty, how much you can do. And yeah, it's not what you think it is. It's almost like a secret society. People don't know what we do procedures.
Yeah,
Shoot, I give injections in the
I give
office.
injections.
You know what I'm saying? Like, so people
I
really
do
don't know.
ADHD coaching.
Yes,
I do hand over care.
right, exactly.
I do
So
virtual practices.
yes, indeed. So if you're thinking about it, explore it. Like we love it. It's great.
Yeah, if you're thinking
Yeah.
about it, explore it, but also realize that even if you don't pick psychiatry as your career, you will interact with someone dealing with a psychiatric problem in one way or another. Just be open to just be open and listen and get them what they need. I actually had a lady yesterday. She's dealing with lupus, and she's like, I kept telling my doctor, and she tried to attempt suicide. She's like, she couldn't get outpatient resources, because her doctor was just like, oh, ignoring it.
Dismissing her.
Yeah,
Mhm.
so you have to treat the whole patient, and sometimes depression and anxiety are just as real as their kidney failure or their liver enzymes being elevated. You know,
Yeah.
That's right.
No, those are very good points. And I want to just add that, as I stated, that figure that 15,600 psychiatrists
Mm.
will be just gone from our field in 2030. And
Mm.
we have about 55,000 right now. And
Wow.
so, as we think about mental health in its own epidemic, well, whatever you want, whatever demic you want to put to
Yeah.
it, it's a worldwide issue, right? And there's
Mhm.
so many, yes, we are destigmatizing the experience for many people as much as we can, in groups, individually, collectively, whatever, but it's still stigmatized. There's still a significant amount of stigma around what we do.
Mhm.
And I will say that we are all on the spectrum. And
Yes.
so I leave you that if this is something you want to do, understand that it starts with you, and make sure that you take care of yourself. Self-care is so important. We would all encourage you to get a therapist if this is the work that you're doing, because you may not be working with your hands for 20 hours as a neurosurgeon, but let me tell you, it can be exhausting working
Exhausted.
with your emotions, your intellect, and then trying to make sure someone is safe at the whole
Mhm.
same time. You
Mhm.
know what I'm saying? And so I think what we do it's an amazing field. I think it should be well respected, honored, and at any moment's notice, anyone can need our help. That's just how viable we are as human beings. You know what
Yes.
I'm saying? And
Mhm.
so I think that this is just an awesome field that has a lot of more room to
to
grow.
grow.
That's right.
Yeah.
That's right.
Mm-hmm.
Amen
Yeah.
to that.
Yes. So thank you, Yes. Thank you, Dr. Centrell. I know you worked overnight. That's why she's tired,
Yes.
y'all. But she's
Yeah.
still her. This is who she is. And thank you, Carolyn. You know, I love you,
Yes.
girl. And
You
I just appreciate
too.
you being here, especially
Yes.
away from your, your sons and
All good.
family. Thank you so much.
Yeah,
Yeah.
indeed. Anytime.
So I appreciate you all. So yeah, thank you for what you do in the field, the gifts that you give to our field, who you are as people. You maintain your own personalities, and yet still you can do what you do. See, our
Yeah.
field doesn't change us; it makes us better. Like
Hey.
I think both of y'all said that in different ways.
Yes.
Yes. So I really appreciate that. So thanks again. And don't forget to follow them, you all. They have their practices listed here. And I also listed their Instagram on the promo too. So don't forget to follow them. Is anyone taking patients while we here?
I am taking patients. Anyone
Dr.
from
Central,
Pennsylvania? Yes, yes.
please tell
Yes.
them. Do you take
Oh, yes.
insurance? Where are you in Pennsylvania?
I'm in Reading, Pennsylvania, but I can see anyone across the state of Pennsylvania virtually, or you can come to Reading if you want. My my website is optionspsychiatry.com. My phone number is 610-741-6567. If you want to get on my schedule, call me. Don't call me right now, though.
You need to rest.
Don't do that.
Right. Don't do that now. I'm taking new patients too, and I'm licensed in the state of Maryland, so I can see anyone in Maryland. And my website is carolynhowellmd.com.
Awesome.
So probably the best way to reach me.
Yes, let me put these up here so that we can get some time. And I forgot the MD on E. My apologies, Dr. Carolyn. Let me spell that right too. So I want to make sure I have these correct. And that's yours too, Carolyn. Carolyn, I will let me down.
Yeah.
Okay. And I'll just keep. I'll make sure that it's also on at the top of the recap too, or the replay, so that you all so that people can get in touch with you.
Awesome.
Yes. Thanks, ladies.
I'm accepting new patients. I'm trying to get to 110 a week.
It's not a goal, okay? It's not a goal. Listen, okay, let me just say something about this. I just feel it's my mission to help as many people as I can, as long as I can. But that timeline is ending soon.
Yes, indeed.
No, but but again, Dr. Centrell, I balance it. So Friday afternoons, I'm off. I travel a lot. You know what I'm saying? So
I know. I'll be like, where in the world is Dr. Is she in Chicago? Oh, she's in Michigan. She's in LA.
I love it.
And I love y'all. Thanks again, ladies. We got to do this again.
Yeah, let's do it again.
We will.
Nice meeting you, Dr. Carol.
Nice meeting you too. Take care.
Love y'all. Thank
Bye-bye.
you. Thank you. And before we leave, I had to say something just about these two beautiful ladies. I just really do appreciate them. We really have sincere, genuine friendships outside of medicine. And I think that's also important that you have that, right, outside of what you do. And so I really, truly appreciate them and their commitment to our future mental health leaders. But before we wrap up, I got to say this. I want to emphasize the importance of voting. All right. And, I just believe in using your voice to make a difference. Your vote isn't about choosing leaders, y'all. It's about shaping the future of fields like mental health, where compassion, we talked about this, empathy, cultural understanding are crucial. All right. So the discussions we've had tonight, I truly feel that they highlight how much we need professionals in mental health who are willing to grow, who are willing to listen. You heard that. And to take care of themselves too. The policies and leaders we vote for play a direct role in supporting those values. So whether it's funding mental health services or ensuring communities have access to care, make sure that you understand the policies, because those things matter. And by voting, you're not just standing up for yourself. You're advocating for the well-being of others. And so take a moment, cast your vote, and know that your voice can help create a better, more compassionate future. Our children. All right. Don't miss the opportunity to make an impact. Your voice and your vote truly matter. And I hope you enjoyed tonight's discussion as well as last week's. I truly hope that the topics we explored have inspired you to consider a career in mental health. And as you continue your journey, keep the conversation going, ask questions, seek mentorship, and dive into learning all you can. From different ways to practice to diverse subspecialties, this field has to offer. Most importantly, stay open to the new possibilities. And remember, you have the power to create your own path in this field, just like many of us have. And whether you're a student, a mentor, a parent, a professional, there's a place for you in mental health. This field needs passionate people like you. Thank you for tuning in to Light on Live with Dr. Dawn. See you back real soon. Bye.